Well, thanks so much, Phil, for having me, and to the whole team here for allowing us to come in and share a little bit about what we're working on, and also hopefully share some resources with those of you who have joined us today that will find valuable. Okay, so it's a pleasure to meet all of you. My name is Laurie Markle, as Phil said, and I'm the Chief of Solutions at Parenting for Lifelong Health. And if you heard Catherine speak earlier, I'm sure you learned a lot about how we believe a lot about empowering parents to reduce violence, improve child development, and promote mental health. And the problem that we're facing often at PLH is that we know that the adverse childhood experiences create lasting negative consequences, but that the delivery of parenting support interventions themselves is too expensive. And we know that because PLH is built on, 15 randomized control trials of a 12 session in-person program where each session takes 3 hours to complete. And if you've ever met a parent before, you know that we don't have 3 12-hour sessions to attend for anything, let alone parenting. And so scaling these programs doesn't matter even if they work, because they're too expensive to deliver, particularly in low resource settings. And it's not scalable for caregivers themselves. And so to help mitigate that challenge, we've been building apps and chatbots and more apps and more chatbots to try to figure out the right mix of in-person components and digital components that allow us to deliver these evidence-based parenting programs that have impact, but that are capable of scaling and supporting parents where they are. So in this process, in partnership with the Global Parenting Initiative and funding from the Lego Foundation and the University of Oxford support, we've been sort of testing all sorts of different modules and models of delivery. And we've really gotten ourselves from delivering a program at $120 per family to less than $1 per family when delivered in a digital-only intervention. Although most of the time we're doing what we refer to as a blended delivery, which is where you've got an in-person component, maybe for onboarding, maybe a remote WhatsApp chat group that parents are involved in with a facilitator, and then they're doing the bulk of their curriculum learning through a chatbot or app. So today I'm going to tell you a little bit about the apps and chatbots that we've been developing, and let you know how to access them, use them, take advantage of them. They're all open source, which means their source code as well as the content that is housed inside of them live on GitHub. If you have a ICT team or a technical partner that you can work with, they can take these products and run with them and adapt them. So the first is ParentApp. We're going to talk about ParentText and FacilitatorApp, but all of these different products, and just to say we're also product agnostic, we'll take whatever works and is already there, and in many cases we do, but these are sort of the 3 we've had to develop to fill known gaps, have distinct purposes and places within sort of scalable parenting support, but they offer some common themes, and that's really core content across the deployments, and that includes one-on-one time with your child, social emotional communication, positive reinforcement, and keeping your child safe. So ParentApp is an app design, and you can scan this QR code if you want to play around with the Kuwaiti version of it, is an offline first mobile application designed to provide evidence-based parenting curricula with a flexible deployment as either a standalone digital intervention or in combination with in-person or remote support sessions. It can be adapted to local cultures and contexts and languages, and the content can be tailored to the user and their child or adolescent with information that they share during onboarding. All of the modules incorporate mindfulness techniques and playful learning activities for users to practice at home. And in a randomized control trial in Tanzania, we saw a 24% reduction in adolescent internalizing and externalizing behavior, 10% reduction in caregiver depression and anxiety symptoms, and a 67% reduction in sexual violence against adolescent girls in the last year. ParentText is a chatbot that is essentially taking that same curriculum, but delivering it to parents in communication channels that they're already using. So that's products like WhatsApp, Telegram, Line, WeChat in China, and and actually I accidentally left WeChat off of China off of this list, but it is in China. And you can scan this QR code, and I think it'll ask you to send a trigger word demo on WhatsApp. So you need to have WhatsApp installed on your phone in order for this QR code to work. But it delivers impact as a standalone intervention or in tandem with in-person support, and has all of the similar user experiences that ParentApp has, but actually can be even more tailored to the user's sort of profile. So depending on the caregiver's gender, the child's gender, the caregiver's marital status, the child's age, the learning preferences of the parent, whether they want videos or audio files, we really can tailor. They get to select the avatar that guides them through the program. This chatbot delivers a 5-day core course on positive parenting to earn a parenting certificate. And then after that, unlocks a library of additional optional courses for parents to take that might interest them. And I sort of am not going to walk you through all the details of these next 2 slides, but it's just to show you that while I'm showing you sort of like one product, I'm showing you a product in its current state. And these products go through many iterations. ParentText started in 2022 with version 1.0. We did a pilot in 4 countries and it completely failed, 100% failure. We then in 2023 redeveloped it twice, first with a version 2.0, then into this 5-day user experience after an optimization trial. We're now running with that 5-day user experience because we know it works. In 2024, we also developed an all audio version for completely illiterate users for Rohingya refugees in Malaysia. We also worked with parents from the DRC, Rwanda, and Ukraine to co-design a crisis sort of focused adaptation of this content that's specifically focused on supporting parents of children in crisis, with content from the WHO, UNHCR, and Global Parenting Initiative. And we also ran a digital-only randomized control trial. And you can see we've kept running in 2025, continuously iterating and working on changing out this chatbot. So you're seeing these products at a moment in time, but it's not what they'll be forever. And it's certainly not where they were before. We're working really hard on replacing certain components of the user experience with generative AI to make it more interactive, reduce barriers to access for low literacy users, allowing them to use voice notes, things like that, into the user experience. And so in 2024, we did a randomized control trial in South Africa where we delivered ParentText to 15,000 users, just through Facebook advertisements, no payment. You just come if you want to learn about parenting. We got a lot of people to join the program. You can see the user funnel here. About 13,000 of them made it through onboarding. 12,000 of them completed the first module, and then about overall 50% of the users who joined stick in the program for 5 days. It costs us 77 cents per user to achieve that outcome. And in the randomized control, we don't have official final results, but we do know that we both at significant impact at 1, 3, and 7 months for positive parenting, gender equitable behaviors, parent-child communication, parent supportive learning, improved discipline behaviors, reductions in maltreatment, child and adolescent externalizing problems, and parental depression. So 5 days, 77 cents, and no human support at all. And we're able to really achieve pretty significant and exciting outcomes for parents and really for children. And then finally, one more QR code for you to scan, and that is to FacilitatorApp. Go ahead and scan that. I think it's going to take you into the Mexico version. We call these things FacilitatorApp, ParentApp, and ParentText, and nowhere where they are deployed are they called these things. They're called whatever the localized branded version of that is, right? So in Zambia, it's HPP Yanga. In Malaysia, it's FaciNK. It depends. But this is an app actually designed for facilitators of either those WhatsApp groups, those support groups, or facilitators of in-person programs even. And this allows facilitators to share pre-drafted messages, including multimedia content on social channels like WhatsApp, Facebook Messenger, Line, create parent groups, manage parents, and include research or program IDs. And then finally, it allows facilitators to receive alerts for parents who need additional support. So it links into that engagement data from ParentApp and ParentText so that if there's a parent who's not performing and not staying involved in the program, they can ping them, follow up, see what's going on. We have dashboards that integrate facilitator data with parent engagement data to create a systems level monitoring and performance management system for the governments and technical partners who are, or program partners who are helping implement this. And then finally, just 3 additional resources that I think you might find helpful, because all of that's open source. So I encourage you to take it or send me an email and I can help you figure out how to take it. But in addition, if you go to parentingforlifelonghealth.org and hover over the word resources, you'll find 3 things: Parenting in Crisis, Localization Toolkit, and Public Resources. So Parenting in Crisis provides you with a toolkit on how to support parents of children in crisis. It also has adapted resources for local context for a number of active crises around the globe. And the localization toolkit has a step-by-step guide. You do have to log in to access it, but it's free. A step-by-step guide on taking that ParentText package and adapting it to your local context. It'll walk you step-by-step on how to do it, plan for sustainability and scale. And then public resources, which is basically every single tested facilitator manual, family guidebook, trainer manual, implementation guide that PLH has ever been a part of or endorsed, is available publicly, all with Creative Commons licensing and available for public use. You can filter the results by language, audience, age group, country, and we encourage you to take advantage of these resources. Hopefully I stayed close to in time, and I'll stop there. Again, my name is Laurie, and it's a pleasure to be with all of you. Feel free to ping me an email if you want to learn more, and hopefully we're able to share also these slides with everyone afterwards so that you can scan those QR codes if you didn't have time to.
That's great.